Okay. Now, we're all very familiar with the Jeopardy round. Let me repeat the rules. That random selection of cards will indicate the order of preference. The providers will choose from category 1 or 2. The health plans will choose from category 3. After somebody answers, they can A, choose to answer it, they can choose to pass, or they can choose to have a lifeline for anybody in the audience or a colleague. Okay. They have 1 minute to answer, and then a 15-minute follow-on round. So, who had number 1?
Christine Kessler.
Okay, so you get to choose a category and an amount. The higher risk, the higher reward. So provider planning, they both go to, provider planning goes to 400, and provider internal operations goes to 500.
So let's try provider planning for 300.
Where should I be in my preparations for ICD-10? Where should I be now in my preparations for ICD-10?
I think this answer really depends upon the size of your organization. The larger your organization, the further along you will need to be, because the systems and the scope of what you need to remediate will be broader. So clearly Seattle Children's, large organization, we're much further along in our planning. If you're just starting, the starting point is to identify who's going to own this. So begin with a person that will be accountable for overseeing all of it. That can likely the person can wear many hats. It could be coding, it could be an IT person, or finance and billing. So the planning is the most important part. Have a clear understanding of where your external vendors are, so that you can effectively remediate your systems, and then begin the planning, and planning to include the systems remediation, forms, reports, and documentation needs identified, as well as the training is a key component.
Perfect.
Much better than the first time.
Okay. Other providers want to contribute to that or add anything? Good. Okay. Who has number 2? Elizabeth.
Billing for 300.
Until October 1, can we use ICD-10 as well as ICD-9? After October 1, can we still use ICD-9 along with ICD-10? And the third part, what about paper claims? Will you accept ICD-9 codes on them after October 1st? So, fortunately, the general question is, the magic date is October 1st. Can I use ICD-10 before that? And can I still use ICD-9 after that? And what about paper claims? Any difference?
For Cigna, we will only accept ICD-10 for services prior to October 1st. On and after October 1st, it would be ICD-10, and this will apply both for electronic and paper claims.
So ICD-10 only after October 1st.
On and after October 1st.
On and October.
Yes.
What about ICD-9?
Prior to October 1st.
Okay, so for Cigna, only accept ICD-9 prior to October 1st, and only accept ICD-10 after October 1st. Correct. And that will apply for paper and electronic claims.
That's correct.
But that's for date of service, correct?
That's correct.
Okay, so good point. What Michelle brought up is that's for date of service. It's not the date that you billed. It's the date that the service was rendered. It has to be that October 1st.
Bill, it's date of service or discharge date. That's what we have.
Okay. Okay, so Evelyn, any addition on that?
No.
Okay. Jessica?
Premera is the same. We will be compliant with the CMS mandate, and that's pretty much it.
Okay. Regents, Sarah?
It's the same for Regents.
Okay. Okay, so next one. Who has 3?
I do.
Okay. You get to choose a category. Edit billing.
Billing for 200, please.
What if I need to initial bill or rebill for services that happened before October 1st? For how long after October 1st can I do that?
For first choice health, it would be 365 days, the timely filing period.
Okay. Premera.
Premera has not defined a cutoff date.
For Regents, for the initial bill, it would be the 12 months timely filing, and then for rebills, It would be up to 24 months from the date that the claim processed, and then Medicare, Med Advantage patients, it would be 12 months from the date the claim processed.
For
Cigna?
Cigna, for Cigna, we will follow the 12 months timely filing as well.
Okay, who is the next one?
I do.
Okay. Provider planning or provider internal operations?
Provider internal operations for 500. Go big or go home, right?
It's a wild card. All right, so this means we get a question from the, first, Michelle, will you accept the question?
I will.
Okay, so any questions from the audience about internal operations that you might be concerned about, worry about for ICD-10? Right up here, a question in the front? Just a minute, if you wait, my colleague Teresa will rush the microphone to you. And again, this needs to be a broad question, not specific to a health plan.
Right. If you have to get a pre-authorization for services and you get it for a certain code, and then October 1st comes and the code is changing, then do you have to get another pre-authorization on that date, even if you had a certain amount of services, treatment dates that you were able to bill for?
Okay, so the general issue is she's gone out, she's done all the pre-auth requirement, she did it using an ICD-9 code, and now October 1st happens. Does she have to do something more? Okay, so.
Because the code's going to change.
Yep.
Okay, so I am not a payer, and that's more of appropriate for a payer policy, but the answer to that question is on One Health Port's Information Central for each individual health plan. We did think about that when we were going through the prior authorization, as well as what happens when you have a period of time that covers the conversion date. So say you need to pre-authorize services that go from September 30th to October 3rd. What is the process? And I believe, correct me if I'm wrong, health plans, but it's based off of the time you request the prior auth.
Well done.
Okay. Any health plans want to add to anything? Elizabeth, you good?
Yes, for Cigna, if an authorization was requested prior to October 1st and the member is going to be discharged after October 1st, you don't need another authorization. We will go ahead and look at that. You only need that authorization given with the ICD-9.
Sarah?
Yeah, that's the same for regions.
Evelyn?
For first choice, we don't require the code. It's either code or description, so there wouldn't be a worry that it was different.
Okay.
intent.
So
The description would.
different health plans do it different ways. Some people are using the code, other people just use a description. So what Evelyn is saying is first choice just uses a description, so it doesn't matter.
Can I add a clarification to that?
After Janine.
Okay.
Janine, the Everett Clinic. One of the things you might think about is we're going to start dual coding our prior auths before it goes live. So anything that we will be sending out for a referral or a prior auth or a referral or anything that we do, we're going to put both code sets on beginning June 1st. So we feel like it'll give our employees an opportunity to practice as well.
Michelle?
The other thing to keep in mind is that in the prior auth section on ICD-10 Central, we did ask that question about whether or not I need to put a diagnosis code onto the pre-auth, and a lot of the insurers say, no, you can just do the description of the diagnostic service. And I know that's a little counterintuitive to how most of us process those authorizations currently. So it's something to keep in mind. You might want to change your internal practice.
So that ICD-10 Central will become a useful resource, you know. So I take a look at that. Okay, who has the next question?
Or is it 5?
I think it's 5. Okay.
I'll take billing for 100.
Okay. How will the transition to ICD-10 impact alternative care providers such as massage practitioners, acupuncturists, etc.?
Well, I think the answer to that question is that come October 1st for dates of service after October 1st, we will require that the claim comes in the door to us with ICD-10 codes for those dates of service. If they
Even for acupuncturists?
Yes.
I'm an acupuncturist. I thought I'd get special dispensation. Guess who's not going to win the grand prize today? So I'll ask that question of each payer, and we'll see.
So that's it.
Yeah. Elizabeth, you want to add anything?
No, that would be the same for Cigna.
Jessica, Primera?
If you accept medical insurance and submit claims, we require you to submit ICD-10
Okay.
codes.
The same for First Choice.
Okay. And this is all true even though I don't get paid by diagnosis. Still have to put it on there. Okay, who has the next question? Yes, Sarah.
Billing for 300.
Okay. Okay, so we've already done that, I guess.
I think that might be used up.
Oh, maybe
400. Sure.
Oh, yeah. Where are the health plan clearinghouses in their preparations for ICD-10?
So for Regents, we've started doing connectivity testing with our clearinghouse Availity, and that started this month. And then we will actually start doing end-to-end user testing first quarter of 2014.
Elizabeth?
Yes, for Cigna, we've completed our remediation and we've upgraded all of our vendor applications, and we're working with our clearinghouses and trading partners on testing.
Jessica, Primera?
Primera has completed all of the systems remediation, and we plan on doing what we call end-to-end testing with providers submitting claims through clearinghouses to Primera and then back. We'll start that in April.
And Evelyn, First Choice.
First Choice, we've completed all the system remediations and are in the process of connectivity testing, and we'll start end-to-end testing within the next few weeks, two or 3 weeks.
All right, so there are two important things that came up on this. One is where are health plans? Only 4 are represented on the panel, but if you go to ICD-10 Information Central, it will give similar information for all of the health plans that participate in this process, of which there's national and local one. That's the first. Use Information Central. The other is a couple of terminologies were used here. Connectivity testing, end-to-end testing. So generally what's being talked about here is if you're going to submit a claim, the first thing is you've got to be able to connect with the clearinghouse and connect with the health plan and just get the claim there. Okay? So as you know, a number of clearinghouses have health plan edits. So can you get your claim from your office to the health plan? That's one level of testing. The next is really process testing. You submit your claim, it's got to be processed, you get a remittance advice in 835 back, that's end-to-end. So starting from you, you send a claim, it goes all the way through the hearing clearinghouse to the health plan and back to you in the form of an 835. That's end-to-end testing. So if you take a look at the definitions, that's what's being referred to in the connectivity and the end-to-end testing. Okay, so what's the next question? 7. Okay, so Karen, category and an amount.
Billing's all gone?
Billing is only for the health plans. So you get to choose provider planning.
Provider planning, what's the top?
100, 200, and 400.
Let's do 400.
Okay. I'm getting pushback from my clinic doc, who is asking why she should learn about new documentation and ICD-10 codes when they don't impact physician reimbursement, since that is still done by CPT or E&M. What do I say? Let me start the timer there.
Yeah. So the reality is if we don't use ICD-10 codes, a claim is not going to get paid. So that would be the first answer. But I think a bigger question by a lot of the providers is, you know, they're here to provide care for their patients, and I don't think they feel that this adds anything to the quality of the patient's care directly. We've talked about we're one of all the major countries who's not using this code system, and if we catch up with the rest of the countries so that our data can be included as they do research, there's outcomes on the research that can provide better care for patients, and so long-term, it is a positive for our patients.
Anybody want to add?
I have 2 words. Medical necessity. You need it. You've got to have it for your CPT code to get paid. If you don't get paid regardless of what code you use.
So it's the diagnosis that gives the information about medical necessity.
A lot of the diagnosis codes provide the basis for medical necessity, if not just the beginning foundation.
Okay. And Janine?
Janine Lambert, the Everett Clinic. I'm going to put my compliance hat on. I don't know how many of you see Medicare Advantage patients, but there's a lot of regulatory requirements around having accurate diagnosis codes. We want to use diagnosis codes if they fall into an HCC category, and the documentation doesn't support it. It really creates problems for our health plan partners.
Yeah, Christine.
One last point, and that is around the external reporting. Recognize that a lot of the external reporting, we're looking in the past, and what we do for 2014 at the start of this will be reported on in the future, so doing it accurately at the point of cutover is key.
Okay, who's next question?
I have number 8.
Okay, Jessica. So you've got billing for $500.
All right, I'll take it.
In anticipation that some health plans will not be ICD-10 ready by October 1st, the processing of crossover and secondary claims will be problematic. So this is a situation that you submit to Medicare, for instance, and they'll cross it over to the next, but it's also done in the commercials. How will you work with plans that you send crossover claims to that aren't ready?
Well, we're in frequent communication with all the plans in the OHP work group. We are part of the Blue Cross Blue Shield Association, so we monitor the status of those organizations as well as across the country and industry. And we will just monitor it very closely and understand who's not ready and who is.
Evelyn, first choice?
For first choice for COB situations, I assume is what that's about. We are monitoring some of our pairs in the state and our other states, and so far people are on track. So we haven't anticipated this happening. It may happen, I'm sure. To my knowledge, we will probably reject if
Okay.
they don't. It'll probably be a case by case, maybe, but we'd be rejecting if
Okay.
they don't build the right version.
Sarah?
For regions, we will be ready for ICD-10 October 1st. If we get claims that come to the door from other payers or crossover claims that aren't in ICD-10 format, October 1st dates of service, we will reject those claims.
And Elizabeth?
Yes, that would be the same for Cigna. And in addition to that, we had been working closely with our trading partners as well to make sure that everything is working by October 1st.
Okay, so we are now out of time. So again, to award the grand prize, I'll go for behind each person, and if you would give a round of applause because each one of them deserves it, and then we'll judge from the highest one who gets.
Okay, this one up here too.
So first choice, Ellen.
Teresa, I'll just give you this one.